There just aren't that many residency programs in the country that pair a commitment with working with underserved patients to real excellence in academic rigor. My colleagues, both the faculty that I was working with and my fellow residents, both were really committed to working with underserved patients, but were really bright and committed to excellence.
The residency program is here to train family medicine doctors who want to work in underserved areas. What that requires is this concept of evidence-based, community-oriented primary care.
It's a natural partnership for them to send interested residents over to train at our site. And really the long-term goal here is to have them stay. With a residency program comes more providers seeing patients. And so in a time when there are a lot of people seeking care, it makes our health center have increased access to care.
I had to come out and check out this program, and when I interviewed and toured on the day, I loved it, and it was my first choice for residency. Even though there are places that do focus on serving the underserved, there was no other place that served quite the community that Carolyn Downs did.
I am pretty crazy about my residency program. I think that we receive not only phenomenal medical education, I think there's something so much more in our residency program, that it really is about kind of social change and passion for your patients that goes way beyond just what blood pressure medication to start.
Working with this population requires a level of finesse and attention to detail and knowing more about their situation and what they can and cannot afford. So I think that was a steep learning curve for me. You know, things on the level of learning the next-gen EMR, for example, and learning to become more comfortable with that.
This residency site within Carolyn Downs and within Country Doctor really offered me the opportunity to work with people who were struggling with healthcare access because their needs extend to the whole person, and to serve the whole person we need a team that really functions effectively.
We want our physicians in training to be involved in the community in a larger sense. That is, we want them to have a larger impact in the community than just within the four walls of an exam room.
I have a patient right now, and he has stage 4 prostate cancer, and most of my care of him has been trying to coordinate care with him and his oncologist, trying to help him navigate the healthcare system, working together with his partner to help him understand his diagnosis and his prognosis. Because this gentleman, I think, doesn't fully understand his diagnosis and prognosis, and making treatment decisions that I think if he knew balancing quality of life or length of life, he may make other decisions. So what I've been trying to do, but has been difficult, is try to talk to his oncologist and get a sense of what type of end-of-life discussions they've had and fill in the blanks here and establish a power of attorney for him. And so that's been most recently on my mind, and every time I come into clinic, I think about him.
One patient that comes to mind was a gentleman who had a recent diagnosis of HIV, and he was really shocked by this diagnosis and really upset. But over the next couple of visits, I just really watched his awareness of his disease and his confidence level in managing that kind of really transform. And I give myself not as much credit in that process as kind of the amazing HIV team and the kind of comprehensive care that I think is really a standard here in this clinic system. Now when I watch him come into the office, you know, we get a big hug, and I just see this really exuberant, happy, confident person. And I feel like we played a huge role into helping him kind of change his perception of his illness and kind of take control back of his life.
We are training family physicians to work in community health centers. The best outcome is to train residents to work in our community health center.
A year and a couple of months ago, I graduated from residency, and I had the opportunity to stay on in a staff physician role. So now I see my old patients from residency. So I now have patients that I've been taking care of for a number of years. I've gotten to deliver second babies within the same family. That continuity has been really wonderful.
I think I'm often surprised and grateful for just how much fun I have coming to work and working with people. Not just the patients, but the staff. It's really a phenomenal place to walk into in the morning. I'm hoping this clinic system will have a hard time getting rid of me because I would love to stay involved in any capacity in the coming years.
If I can improve the health of my community, I think that'd be great, and I feel like family medicine and specifically working through community health centers is going to be the way that I make that difference.
The clinic has really dedicated its resources to serving the type of patient that we need to take care of, and doing so in a way that respects them.
Patients like that are a good reminder of what I really try and do kind of across all spectrum of disease, but not only disease, also social circumstance and all the other things that I think really brings patients into our clinic system.